The Northwestern Health Unit has publicly released an assessment report outlining the need for safe consumption sites in 4 Northwestern communities. Carl Langdon reports.
Today, Northwestern Health Unit has released a report that examines the need for supervised consumption services in 4 local communities: Kenora, Dryden, Sioux Lookout, and Fort Francis. Each of the 4 communities' rates of substance use harms are significant, and supervised consumption services are recommended to reduce the risk of overdose and overdose deaths to people who use drugs.
Safe consumption sites already exist in Thunder Bay and other parts of the country, such as BC. Dr. Kit Young Hoon notes some of the major benefits associated with providing these services. Benefits that not only extend to individuals who use drugs, but also to the wider community.
Research has shown that the sites can have benefits, including reducing overdose deaths, decreasing the spread of infectious diseases, reducing discarded drug equipment near the site, and increasing the use of healthcare services, including treatment services.
The assessment offers recommendations to stakeholders, but while the report outlines needs, there's no clear path on who will address them and how. This lack of clarity and the stark differences between the communities named leaves those who are already supportive of the inclusion of safe injection sites seeking practical ways forward. Mayor of Sioux Lookout, Doug Lawrence, noted his appreciation for the services recommended and for what he calls a progressive report on something that needs to be addressed. But he says his community faces unique issues with alcohol and with finding service providers to commit to delivering services locally.
It's really a little bit of an uncertain path. It's the healthcare system or the social service. Where does the line of responsibility lie? We absolutely, I think a safe consumption service would be excellent for Silicode. But what is it more dire need is a managed alcohol program.
Sioux Lookout's response was to open a safe sobering center in the next coming weeks. The push to deliver the service met many of the same challenges that municipalities named in the report are expected to face. With a limited number of service organizations in the region with the expertise required to take on the task, and a lack of physical space, Lawrence's reservations on where the burden of responsibility lies are bound to be repeated in discussions held across the other 3 communities. Carl Langdon, TBT News.